Welcome to another episode of The Worthy Physician. I'm your host, Dr. Sapna Shah-Haque, and today I have Brittany Busse, and she's a physician who has really had a career pivot, and I find it quite fascinating. Brittany, thank you very much for being on here.
Of course. Thanks for having me, Sapna. It's really exciting to be able to speak with you again and with your audience this time.
And can you tell us a little bit about your journey and what led you to start your company?
So, I guess like most physicians or many physicians, I started my journey towards medicine as a child. I don't have any physicians in my family, but my mom is a nurse. And I just remember her saying, like, you're really smart and smart women should become doctors. So he's like, I just think that that's the right path. And we're really going to dedicate your intelligence towards science. And I did have this natural desire to really want to help people as well. But I do know like that's really something that comes to the forefront of my mind is like, if you have a gift for something, then you're going to use it towards something that, potentially gets you the most recognition or the most money or whatever it was that my mom was thinking at the time. And really just kind of like starting down that pathway, like, well, if I'm going to be a doctor, what kind of doctor do I want to be? And I was really interested in a variety of different things. So my mom happened to be a psychiatric nurse specialty, and she kept a lot of old psych books lying around in the basement. And I just loved reading the patient case reports and the case studies. I mean, this is like old school psychiatry. So it was like some really funny things, like if you were to look back now, like written in there. But as I progressed through high school, I had a lot of encounters with people with mental health disorders. I had a friend try to commit suicide. Actually, I had two friends try to commit suicide. And I happened to be the person that they told and was the one who ultimately had to get their parents to intervene. I had a one friend who suffered from a long term drug addiction. He worked in a pharmacy as a high school student and was given just crazy access to narcotics and started a lifelong struggle with addiction. So I kind of started feeling like the best way for me to help people was to kind of stay down that pathway. By the time I got to medical school, however, and I started doing my clinical rotations, and I saw the actual practice of psychiatry really just being like, let's throw this pill at somebody and see if it sticks. And then try this if this doesn't work. And there wasn't really a lot of room or time for patient care and like finding out the stories behind what caused the symptoms to present in the first place or what was that person's story and how are they feeling. And I just didn't feel like I was being effective. And, a lot of what we want in medicine, what I wanted at least, was to accomplish something at the end of the day. Like to feel like I was making a difference in people's lives. And no matter what rotation I went through, I just didn't get that feeling until I did a surgical rotation. It was like, oh, okay. Like this guy came in with a hernia. We sliced it open, we sewed some mesh in there, and he went home without a hernia. You're like, all right, like if I want to feel accomplished at the end of the day, like I'm going to need to do like procedures. So I think when people look at procedural specialty, they say, oh, well, people choose it for the money. And not always that. For me, it was really about that sense of accomplishment, of self esteem that I wanted to get at the end of the day. We look at that self esteem as something that is characterized by positive achievement and looking at ourselves as someone who's capable of achieving things and adding those achievements up in comparison to what other people are achieving. So if at the end of the day you feel like all of your patients have backslid in their diabetes and no one's blood pressure is getting any better, that sense of achievement kind of goes way down and your self-esteem will start to follow it if that's really where you're putting your value. So that's where I was at the time and I put my value into my surgical specialty. Um, but the surgical training, as many people who have gone through surgical training may be able to relate to, not the work that's hard, it's the attitude of the people around you. And I really didn't fit their mold of what a surgical resident should be. I really wanted to separate myself in terms of like, I work for work, I have life outside of work. and my beingness as a doc is not wrapped up in being a doctor, right? Like I have all of these other facets of myself that I want to pursue outside of medicine. And as a resident, that's just not really an option, especially as a surgical resident. Like talk about the 80-hour work week, but it didn't really exist for me as a surgical resident. Like that's just 80 hours in the hospital. Like everything else, like your time on call and your pager that you're carrying around, I think that was all outside of that. And to be wanting anything more was almost seen as like a weakness. And during my time as a resident, I was diagnosed with bilateral retinal detachment. And I ended up needing emergency surgery, having that taken care of, but the recovery was really difficult. And I was beyond not supported. I mean, my program was flat out abusive. They were very adversarial with me during this time, as they had been prior to this, but it was kind of like the last straw at that point for me. I was like, my body is literally giving up. Not that being a surgical resident can cause retinal detachment, but it was almost like that was the fate there. It was like you would value your eyes so much for this profession. And what if all of that was taken away? What if you never had vision again? And how could you rebuild your life? And I was put in a position that I had to start thinking about what is vision? Like, what is my vision for my life? What is the plan going forward? Like, who do I want to be? Not just what do I want to do? So I really started to explore that and took on a variety of jobs. As a physician who didn't graduate from a board specialty, it became very difficult for me to find a job, right? Because most hospital systems, they just view you as your board specialization, not as a person. Like I wasn't a person with skills. I couldn't write on my resume, like I'm really good at empathic listening and working with patients and, you know, working on their history. Like now I know there's all these other options. But at the time, if I was just looking for a job, that wasn't possible for me without a certification saying what type of doctor I am. So it's not just enough to be a doctor. Now you have to be a type of doctor in order to have value in the system. I worked at urgent care for several years and then ended up working in telehealth through a variety of different specialties, mainly in occupational health and workers' comp, and really founding telehealth programs centered around those specialties and figuring out ways for physicians to do more with technology so that they could have more freedom to do other things. Like I said, it's really coming back to my own values. Like I just didn't want to be a doctor all the time. I didn't want a lifestyle where I had to work 8 hours to 10 hours a day and then come home and do more work. So my whole life's mission from then has been to find these ways and tools to reduce the amount of work I actually have to do while still creating optimal outcomes for patients. And then transitioning that into our business, Vital Health, help physicians take advantage of everything that is truly their specialty and their gift, not just what's in their board licensing or the things that other people have told them that they're good at, but what are the things that they're truly excited to do every day? What's going to give them that feeling of accomplishment at the end of the day? And what tools can we basically put all together in one place so that they can truly experience the best of doing what they love to do and everything else can get taken care of by technology or by another person and creating that high tech and high touch experience for physicians.
Thank you for sharing that and being vulnerable about your experience.
Yes, yeah.
But you said a lot of things that, really, really hit me. You wanted to know the patient's story. And I think that's very important when we, as physicians, and it's even pertinent to surgical specialties, because you're right, we don't get to the root of the problem. That's not what gets paid for in the system, nor do we have ample enough time. So you're seeing people, you're not just seeing patients, you're not just seeing a number, and that you valued your surgical specialty, but that you weren't that was not all that you were. You weren't just a doctor. And that now that you've transitioned into your company, it's your mission. So to me, those are very powerful words because I think you embody, and what you've said, you embody what many physicians feel. So tell me, how can physicians use technology? Because it's changed. I mean, the field has changed in the last several years, particularly probably in the last two with AI. So how are you seeing that help physicians uh, be more into the high touch, efficient, and high quality?
I think it's definitely about balance, right? I mean, anytime there's a new technology, it seems like, and they're like, oh, we can use this for healthcare. And they're trying to sell it on it makes your life better for physicians. And if you look back at the history of electronic health records, right, they were supposed to make our life more efficient and we wouldn't have to try to read through each other's chicken scratch to try and figure out what had happened with our patients. And documentation was like supposed to be instantaneous, and think of all the hours a day that doctors were going to save now that they have electronic health records. And every single doctor listening to this has used electronic health record and it knows that is absolutely not the case.
Right.
Death by 1,000 clicks is a thing. There's really no streamlining to the workflows in pretty much any commercially available electronic health record, at least any of the ones that I've used. And the more they do say they streamline certain features or try to make things more useful to us physicians from their technology standpoint, the more gets lost in our ability to actually do what we need to do every day. So, like, for instance, we have Epic. Most people have probably used Epic in some point. And if you haven't, you probably at least are familiar with what it looks like or not. But it uses a lot of tools that are helpful, right? Like, so you have dot phrases, so you can have templates that are pretty simple for you to keep. As far as, like, for me as a surgical resident, that was awesome, right? Like, I had like a dot lap chole, and I could put in this note for a lap chole, and all I'd have to do was fill in like the blood loss and the fluids given to the patient and any pertinent details if there were complications, and it would just print out a thing that was like a lap chole was done. And that was really time saving for me, right? Like, some doctors still preferred to dictate, but like for me, I was like, I can literally do this in 60 seconds. I can write a note on this um, thing that happened. But flip side of that, which you see all the time, is note bloat. So if you're a consult and you don't want to rewrite the patient's entire history, nor do you want to ask the patient about their history, you can actually copy and paste the internal medicine note into your note. And then you add your note on the bottom of that note. And now you have a note that's like, probably, if you printed it out, like 10 pages long, because you have the internal medicine intake note plus the consult note. And no one can read it and figure out what's going on simply with that patient. So that was a feature that was added probably to be helpful. And in the end, ended up wasting a lot of people's time and making notes impossibly long. So when it comes to technology, it's really important to evaluate it from that angle. Like, what can we do that's actually helpful for ourselves personally using the technologies that are available? So AI is a really good example of that. A lot of people are looking at AI scribes, which is really useful, especially if you are somebody who wants to dictate, or in the case of taking the computer out of the patient room, so you're not typing the note and you're just recording the conversation as it's happening, so that you can go back in later and edit it. But those things are not useful necessarily, like I said, across the board, right? Like, so implementing it into the hospital system and making every single physician use it the same way doesn't make sense, because physicians like me prefer to rely on our memory and process and synthesize information as it's coming in without even needing to type it or write it down. But other physicians may want that, scribe of the conversation so that they can read it and process it later. We all have different strengths and different learning styles, right? Like, learn that repeatedly looking at students in school, right? Like, some of them learn auditory, some of them are visual. So the technology needs to be adapted to help those who have weaknesses in certain areas. We don't need to just turn it on for everybody, because for some people it's going to be an impediment to their work, and for other people it is going to be an asset. And that's really where the high touch part comes in. It's that finding the right balance of enjoyment versus technological intervention, and then using the technology for things that maybe we don't know how to do as well. So, I love the aspects of lifestyle medicine. I love nutrition, exercise. It's something that I use a lot in my daily life. But many physicians, and understandably, don't know a lot about nutrition, right? It's not a class that we took in school, aside from like the basics of this is the basic protein, fat, carbohydrate, you know, balance that a patient needs on TPN. It's like, okay, well, how does that help our patients in daily life who are actually eating food? So where I see that is like AI could be really helpful as far as helping doctors come up with nutrition prescriptions for patients, looking at that patient's needs as well as their preferences and saying, I would like to write a diet plan for high blood pressure for a 69-year-old patient who hates broccoli. And you could literally ask that as an AI prompt, right? And say like, and they have a limited income. So let's say they have a limited income, they need less expensive groceries, and the AI will actually tailor the plan to those specifications. And then it's up to you as a physician to look it over, make sure that you don't see anything, glaring on there that could be a problem for your patient. Like maybe too much potassium or something like that, or not enough potassium if they're on a diuretic. And like really tailoring that to what you know and what you do to, but you have that baseline, right? Like you have a place to start. And so generative AI is really helpful in those situations where you need to generate large amounts of data in an area where maybe you don't have the strongest knowledge base, but you have a general understanding of it and can apply it to a specific situation. So, really looking at how we work together with technology, especially AI, and not just using it for, like I said, simple low hanging fruit like note scribing. Because, like, the last thing I want to do all day is edit a bunch of AI scribed notes. Like, that sounds more tedious to me personally than writing the notes myself. Like I said, it's all about person and personality.
That's fascinating that, you bring up that tools can do that. So it's really looking at, okay, how can we offload things from the physician? How can we mainstream this and time save with the tools that are available? And just like what brought you into that? How did you fall into that? How did you fall into this area? What gave you the inspiration to create this?
It's really like following my own intuition, right? And the things that have been exciting to me or not exciting to me over the course of my career. So, started in working in urgent care. I was really tired and really burned out. I was working 12-hour shifts, no official break because they had to have the doctor on site at all times in order to bill Medicare. So, it's not like I got to leave and go have a lunch break. Um, and then I would work those 4 days a week. So 48 hours a week minimum, including like when patients come in right when you're about to close and you have to stay and take care of them after the 12 hours are over. And I just felt like after, I think I worked there 4 years, I just couldn't do it anymore. Like it was too much, even with nothing to take home at the end of the day and 3 days a week off. It just didn't make sense for me anymore. And that was in 2016, and telehealth was really starting to become more visible. Wouldn't say it was really prominent or that many people were using it, but um, I could see the ads around. So like Teladoc, PlushCare, Amwell were probably the three big ones that I saw. So I started investigating, whether or not I could work for them because I thought, oh, I had a friend who was a consultant and she lived in Bali. I was like, I love to travel. So if I could practice medicine not from a clinic, that would really, speak to my authenticity, my need for freedom from a set location. And I could practice medicine and still continue to do what I love to do and what I've been trained to do as a physician, as a telehealth physician. The reality, though, of being a telehealth physician in 2016 was really high cost to you personally. You had to have a lot of licenses. You had to carry your own malpractice, and there weren't a lot of patients. So the companies would want you to sign up for their program, and then they'd be like, "Well, we're not sure how many patients we're going to send you." So that wasn't really the right opportunity for me. So instead, I found a job as a medical director. And as a medical director of the company, that really helped me because I was able to take what I knew about the workers' comp system in this case, just from working in urgent care, and what were the inefficiencies of the system? What did the patients hate about the visits? And translate those into a process for workers' comp visits via telehealth. It was really helpful for the patients and the doctors, as well as the employers, and helped people get back to work or stay at work so that they could continue to be productive and feel like a member of the team. So it was like really following that desire that I had to create and to be a part of something new. And then continuing to do that. But as I did that for another company, they started shifting what I was in charge of doing to things that I wasn't really passionate about or interested in or authentically wanted to do, especially during COVID. I did a lot of COVID return to work evaluations, which were tedious and monotonous and could have probably been done by an AI. If you want to talk about things that AIs can do better than doctors, tedious work is going to be at the top of my list. But that really put me in the position to say, like, I've done all of these different things. And the most important driving factors for me this whole time have been freedom, autonomy, creativity, as well as a service to others. And just like I saw the workers' comp system had all of these inefficiencies and the ways that it was ultimately harmful to the patients, as well as the employers who are paying for it, I said, how can we translate this to the people I actually care about the most, which are my fellow physician colleagues? Like, no one should have to struggle the way that I struggled and the way that we all have struggled. I don't think that that is necessary. I don't think that working just to get by, working to survive, just for a paycheck, and hoping at the end of the day that that paycheck is enough that you can buy enough things that you can feel accomplished and you can bolster your self-esteem enough at the end of the day to overcome burnout. This is not possible. Like, self-esteem is not the antidote to burnout, right? Like, the reason why I wanted to join you on this podcast, I think the worthy physician is optional and it's possible. It's what I had to eventually find through all of this was that so long, even from my mom telling me to use my intelligence, right? And to achieve A's and to do all the right things and to hit all the right marks to become a physician, and having this goal of achievement as tied to my value really sets me back as a person, because you'll find that you just want to keep doing and you keep wanting that extrinsic motivator. You need someone else to tell you that what you did had value. And there was a study that was done with children, and being a mom, I get really interested in this kind of stuff too. And it was showing that these children were told they were really smart and that, rewarded for their achievement, actually started to really struggle on challenging tasks. So if they were told they were really smart, they would choose easier tasks so that they could accomplish those things and therefore earn the gold star that they wanted. Whereas the other group of children was told that they were capable of doing hard things, essentially, and that they could figure out any problem and that they had the abilities within themselves to overcome challenges. And they did overcome challenges. Like, they would choose more challenging things and overcome those things. And they got a sense of pride just in accomplishing them. Or even if they failed, they were told, wow, at least you tried something hard. You had the desire to do something difficult. And the kids who were in the really smart group tended to lie about what they achieved in order to make themselves look better. Whereas the kids in the other group were like, yeah, I failed. No big deal. Like, I didn't quite hit the mark this time, but I know that next time I can try again and I can keep doing it. And as personally myself, I definitely see myself in that first group, right? Like, I was told I was so smart and not necessarily that I could accomplish anything, but that using my intelligence, I could overcome certain challenges. And when things got too challenging, it just meant that maybe my smarts weren't geared towards those things. So I wanted to go try something else. So I was really good at standardized tests. I was really good at circling the right answer out of 4 answers and really good at memorizing information and not necessarily using information to overcome challenges. And so that's how I like to see this was that the kids in the first group or given worth based on something that they had no control over, really. And the other kids were given the ability to gain their self-esteem or to grow their self-esteem. But what I see as like self-esteem versus self-worth, that's a really important distinction, right? Like when you're talking to your kids or how we want to speak to ourselves now, like our inner child who really just needs us to validate them, you just need to tell that person like they are inherently good enough. Like, you're not just good enough because you were a doctor, and you're not just good enough because you did 10 lap choles, like, you are good enough. And nowhere in our medical training system has anyone ever told us that we're good enough. Oh, you got into medical school? Well, so did a bunch of other people, and you probably just fill out, and then we'll just replace you with somebody else who deserves to be here. Oh, you got into this super challenging specialty that's really difficult to get into, like general surgery? Well, we're going to make your life insanely difficult so that you have an unattended attrition, and you just drop out, and we just replace you with somebody else anyway. Or you burned out. It's your weakness. We can always just replace you with another physician with your same qualifications. There's no one telling us at any point that we're good enough, that we can do this, that we have gifts, that we're inherently valuable beyond what we can do. And that's really where the patient physician relationship comes from, right? That authenticity, that vulnerability, that desire to connect with another person and make their life better. And the physicians who are thriving in private practice, they've grasped that, right? Like their day is not a numbers game. Their day is bolstered by those authentic relationships that they have with the people that they encounter in the exam room, the people that they know, and they know their life and they know the story and they know why their patients do what they do and make the choices that they make. And so that they can help point them to alternative choices, right? Like, so when I see a group of physicians struggling day in and day out with so many of the things that I struggled with when it came to defining my own self worth and following my authentic voice and realize it had been guiding me this whole time. Like, that's where I wanted to make a difference. That's where I wanted to take my company, right? Like, let's help physicians find out what's worthy in them, the value that they already have, and help them build the foundation of their practice on that. Because that's what's going to draw the patients to your practice, not all the Facebook marketing and Google AdWords and keywords and all of that fun stuff that I can do, but I don't really care to do, right? Like, your AdWords, your presence, that's what draws the patients to your clinic. Your niche, your specialty, like really, truly deep down, you're not just a family practice doctor, right? Like, you have something in you that is a special niche in family practice. And patients will be drawn to that, right? You will find the patients who need the type of medicine that you're practicing. And my goal is just to create visibility around doctors so that they can take advantage of who they are and really feel that sense of self worth at the end of the day, with the added benefit of also some self esteem as they accomplish the steps that were set out in front of them.
Thank you for sharing that. I got goosebumps when you were talking about this because you're absolutely right. We're not taught that we're good enough, that we're worthy. I mean, it is exactly like you said. At any point, we can be replaced because, somebody would love to be in your seat. And so that really strips away the humanity. But you're starting to inject that back in because you're seeing that physicians, we all need to show up as our authentic self. Like you've found your authentic self. Your your company is your mission, but it's also true to your core values. And so now you're helping other physicians find that. And that's a beautiful mission. And you're absolutely right. What keeps physicians going, I think, what keeps me going, I can speak for myself, what keeps me going is that yes, um, the patients and you have to know their story. You get to know it over time. And, I'm the one that writes I'm internal medicine, so I write those long notes, but, you know, all joking aside, you have to know the story. You have to know the patient's past and to connect, to help build that, uh, hopefully a long track of healing or at least living life a little bit better. And then you help physicians with tools to achieve that. So it's a ripple effect, and that's just a beautiful place to be.
Yeah, we really look at what we can give physicians, like in terms of a product or a service, or what would you hire Vital Health to do? I mean, there's a variety of things that we can do and that we offer. Like I said, it really has to be tailored to each physician, and so I like to meet with them first and hear their story and hear about, what is driving them forward in this moment, what caused them to say, maybe I don't want to work here anymore and I would like to do this a little bit differently. And then I can really focus on what are your needs. So most people generally need a telehealth platform. There's hundreds of them probably out there. And they're all a little bit different, or at least in EHR, if it needs telehealth or not. But, really knowing how they need that platform to work for them is an important part of what I do in building out their EHR or telehealth platform experience. Most of them are just out of the box, right? Like I said, and it's maybe missing certain things that the technologist decided you maybe didn't need, that you need personally, or and they're just kind of looking at like what is this generalized workflow that every EHR needs to do, and that's not the same for every physician or every specialty or every practice. So looking at what your practice needs versus what it doesn't need. And then what are the additional tools that you want to utilize within your practice? And what is the methodology you want to use, like for payment? So we have to talk about payment. I know doctors hate that, but there's a lot of models out there for payment. Do you want a membership based practice, more of a direct primary care model? Do you want a hybrid model, which is direct primary care and some fee for service patients? Or do you want to do strictly fee for service model? And in that case, you'll need, credentialing and contracting with the different insurance payers. So it's really a matter of looking at what model makes the most sense for each physician from that very like core standpoint, right? Like some people love a membership model. It's simple, it's accessible for everybody, it covers the cost. But then there are other people who say like that leaves out Medicare and Medicaid patients. And I actually, not me personally, but say like I, the physician, really, really passionate about helping people with Medicaid. So I want to do a fee for service model because that's the only way I can reach Medicaid patients. And that's beautiful. Like we can help with that. We can look for ways that we can help with the administrative work of getting Medicaid or Medicare authorizations, that we can make sure you're getting paid for your time. So there's a ton of CPT codes out there outside of just general exam codes that can ensure that physicians are adequately paid and compensated for the time that they spend with patients so they don't feel like it's a numbers game in a fee for service model. So we really take advantage of experts who know the CPT codes and who know Medicare and who know how to get reimbursement on behalf of the physician, because a lot of revenue cycle management billing companies that I've worked with, they actually will try to block you from billing certain codes because if it gets tossed back, that's more work for them, right? Like, so they have to go after your money if you don't have the documentation to support it. Whereas our company, we hire them specifically because they go out of their way to make sure that physicians are paid adequately for their time. So it's really important to find that balance. And then also between visits, we can offer healthcare coaching and people who make sure that physicians and patients are communicating on the same wavelength, right? Like we all know that health literacy is low in our country. So sometimes what you say as a physician goes straight over your patient's head, not because you intended it that way or because like you didn't. Most of the time, we just don't know. Let's say, like, patients don't feel comfortable telling us they didn't understand what we said. And so they're going to go home and they're going to make their own assumptions based on what was said. And sometimes those assumptions lead to them not taking their medications as directed or not following a diet or being non compliant. And it's not non compliance all the time as much as lack of education, lack of understanding. So, and then you only see that person maybe once every 6 months, every 12 months. And that's a lot of time for them to lose track of what you talked about. The goal of the healthcare coaching is to continue that conversation, this conversation that you initiated with the patient. And the healthcare coach just continues the dialogue with the patient until their next visit so that they've actually made steps towards better health, towards deprescribing, towards getting their blood sugar and blood pressure under better control. So, and again, that's all reimbursable. That's all things that we can use to provide additional income to our practices so that we don't end up having to sell them to hospitals or becoming employees of private equity. There's just so many beautiful ways to bolster the economics of your practice that require very little extra work on your part if you have a partner who can do the extra work for you. That's really my goal is to make it easy on us doctors. Practice
Smarter.
sustainable and simple.
Yeah, work smarter, not harder, and again, sustainability. So that way we can have, like what you said, the freedom, the authenticity, the creativity, and still provide service, like service to our communities. And for the listener, if they wanted to get a hold of you and set up a call, how do they get a hold of you? How do they do that?
Yeah, I'd say there's probably two main ways people find me. The first one would be LinkedIn. So I'm pretty active on LinkedIn. It's really the only social media that I use nowadays. I'm definitely a victim of the Instagram time suck, and I haven't really been able to find the professional balance there. So don't look for me on Instagram, especially right now, because I deleted the app again. LinkedIn, I can manage because it's on my computer. I don't have it on my phone, and so I have that nice like separation between work related social media and not browsing after hours. And then you can sign up for free. You should get a welcome email. In the welcome email, there should be a link to schedule a 30-minute call with me. But if for any reason that's not working or you don't see something, just reach out to me through LinkedIn. Just message me. I'm always answer my DMs. So never feel bad about messaging me on LinkedIn.
So there you go. She has drawn the boundaries. And what is one last pearl you would like to leave our listeners?
I would say that, just a recap of your worth is not in question. It's what you were born with. You are irreplaceable. So I think many physicians, when suicide comes up, I really think that that has a lot to do with that. Like they say, I'm replaceable, right? Like no one needs me personally to do all of the things that I do, but you're not. Like you're irreplaceably you. And there are a lot of people out there who are interested in seeing you succeed and who can benefit from your authentic gifts. And if you just need any help finding what they are, finding inspiration, you want to talk to me or another doctor, I'm happy to help. So please do reach out to me because you are worthy and you are irreplaceable.
Thank you for that. I think we need the reminder that we are not replaceable, are we? We're replaceable maybe in the work context, but at home and in the lives of our family, friends, I'm going to say it, patients as well, we're not replaceable. The pain that the survivors, the ones that still are alive after someone dies from suicide, it's real and it's heavy, and there are resources. 988, Physicians Anonymous, Physicians Coach Support, and like Brittany said, reach out to her, reach out to a friend, a colleague, somebody you trust, because you matter. No matter what circumstances, you're a human being, you're breathing. Let's keep you breathing.
Agree.
Thank you very much for that. That I hope anybody that needs to hear this hears and listens, and hit rewind and listen to it a couple of times if you need to. So thank you very much for your work, and these links will be in the show notes.
Excellent. Thank you so much for your time and for your podcast. Like I said, the worthy physician is really asked for cause. And I think it's something that more physicians need to gravitate towards, like seeing their worth, because they won't create the practice that the world needs from them until they embrace who they truly are.
I couldn't agree with you more.